Good evening. My name Good evening. My name is Judith Fulton. I'm a student at ECPI in Nursing 600 Pathophysiology Advanced. My instructor is Ashley Foreman. Today is June 10th. We are going over unfolding case studies. The goals of this particular case study is for the students to be able to exemplify collegial communication while discussing the pathophysiology related to diabetes, pure ulcers, and diabetic neuropathy. Students will be able to discuss the impact of the A1C on the healing process. Staging pressure ulcers will be accomplished by utilizing the NDNQI guidelines and practicing the NDNQI pressure ulcer education module. Students will identify safety concerns and identify resources and interventions related to those. Students will also identify psychosocial and emotional concerns and identify resources and interventions. Students will also utilize the NAMDA guidelines to formulate nursing care plans. These two references below can be accessed on your computer for prevention of pressure ulcers, some general information, and the HRED pressure ulcer change packet. Both of those are rich tools that you can utilize in your research for information related to this education. This is just the beginning. This starts you thinking so we can work together and do the research and get this information and learn together. Before you begin, the student will need to utilize the assigned text, resources provided within this PowerPoint, and scholarly literature review as a group and individually to gather the basic information necessary to meet the goals for the case scenario. The expectation is that you have read prior to coming into together today, that you will have opportunity to do more work in your groups. Before we begin again, before you start, if you haven't read already, I want you to take time out to identify the predisposing factors for pressure ulcers. You will also summarize pathogenesis of the diabetic foot ulcer. Students will summarize staging of ulcers. You will also be able to identify stages of ulceration. You will summarize pathogenesis of diabetic neuropathy. Also discuss the impact of altered glucose levels on the healing process. You will also discuss phantom pain and identify two interventions. You will also identify two safety issues for the patient with diabetic foot ulcer and amputation. Some of the background you need to know about this patient is basically social history. James is a 50-year-old African-American male. He's divorced. He is a business executive. He lives alone in a 2-story townhome. He has a 10-year-old daughter who he shares joint custody with his ex-wife. And they do presently live in different cities. Family history, maternal, it's listed here, first paternal on the opposite side, and his siblings are listed as well. As you review the patient's family history, are there any inclusions or omissions that raise concerns or questions? Also, allow for time for you all to sit together and discuss and review if you all need to as a group, or you'll have that opportunity when we break up in groups to discuss it, and we will come back together, and each group will be able to present. We'll rotate who presents for each section. And if you have anything to add, we'll let each team or representative have an opportunity. Environmental effects. What do you think of? He lives alone. His vision, as he said, he has some diabetic neuropathy. Injury position on the heel. Patient was unable to visualize well prior to being admitted. He does have steps in his home. His bedroom is on the second level of his home. With the environment data that is not here, that he supplied. Are there any discharge concerns that you have related to his care and follow up? If so, what are they? And when you're thinking about that, when you're in your groups, what resources are there if you think he needs it? What can you do, or how can you help him prepare to go home? His past medical treatment. He just takes standard care for a patient with IBDM and hypertension. Nutritionist consult has been done in the past, which is not fully compliant. He states he does better some days than others. He also goes to a podiatrist for his toenails on occasion. We do report that sometimes when he's busy, if his toes are a little sore, he will cut them himself. Think about this information and decide if this is pertinent. You take care of your care. His medical history. As you see listed here, he has no allergies. He was diagnosed with IBDM 3 years ago at the age of 46. He takes Novolol daily, but unsure of the correct dosage. He states he changes his dosage depending on how he feels. He was diagnosed 5 years ago at age 45 with hypertension, for which he takes Otensine, 20 milligrams every day. So there again, take a moment to look at this information and what is there and what's omitted, and make note of it. Upon opening the case, the patient reports to you from the ED during the visit. He states that his daughter was visiting, and she noted that his foot was oozing and leg was warm to touch. The foot was also wrapped when he arrived on the floor. According to the patient, he is being admitted for antibiotic therapy and regulation of blood glucose. The reporting nurse states one was irrigated post-sharp debridement on an ED. Site was more involved than anticipated. Tissue samples were sent for evaluation, and providers are concerned about osteomyelitis. CBC was sent, blood cultures, type, screen, also drawn, and results are pending. But do note, is there anything that you all notice in the statement about your case that you should be concerned about? Are there any incongruencies? The ex-wife and the daughter come to him to the unit. The nurse is waiting. You're presently awaiting orders. While you're awaiting orders, I've supplied just some things for you on pedal pulses, just some sites you can check to evaluate pedal pulses on your patient. And staging of wounds. Also, when you have the opportunity to undress it, this is just a sample. You will be completing the NUR600 modules, and the link here is your PowerPoint to go through these to get better understanding. Very involved and very thorough modules. And once you've completed everything, you'll turn the certificate in associated with those modules to verify that you have completed successfully processing the staging process. Well, what happens next with our patient? There again, he arrives on the floor. He's admitted for antibiotic therapy debridement and regulation of blood glucose for the patient. His ex-wife is there. You have your patient, nurse, and nursing assistant. These are the people who you will interact or act out when you're going over this scenario and discuss what the plans are, what each of your roles would do, and how you handle each other. Again, collegiality is going to be very important. Think about the emotions of each person in those roles. Critical thinking questions while you're in your roles, and it'll take a few minutes. What supplies would you anticipate will be needed in the room? What education could you provide, and to whom? The patient, the wife, the daughter, prior to orders being received. What supplies might you anticipate needing for the patient? What labs, activities, diet might be ordered for the patient at this time? What would you anticipate? What education, if any, might you begin prior to orders being received? Once again, would you educate the wife, the daughter, and the patient? Then you'll break up in groups and we'll come back in about 5 to 10 minutes to this. After the intermission, we'll have each of you give an opportunity to discuss what your thoughts are or representative from your group, and then if any of the others have one to add. Now, what happens next? When orders do arrive, the patient is ordered antibiotics, plan is to hydrate, regulate glucose, and then start antibiotics. Patient will be prepared for amputation if the foot is unstable. With this, what did your patient come up thinking was going to happen? What issues may arise related to this misunderstanding or miscommunication, or just the lack of willingness to accept what the physicians are being said? And what resources and interventions can be utilized to assist the patient at this time? What is most critical at this point in communicating with the patient? Critical doubts. There again, how can you reconcile the plan with what the patient anticipated? What pain meds would you anticipate? Antibiotics. Other meds would you anticipate and why? What resources would the patient need? Is there discharge information needed at this time? If so, what and why? How would you share the information or teach the information best at this given time? How would the patient need to be taught? Discuss this there again in groups and decide what you think those answers are. You may all come up with the same answers, but work only in your groups. Then we'll come back together and we'll alternate who goes first. Final unfolding case change. We've talked about the patient coming in with anticipations for orders. We talked about the realization of what the real orders are and the incongruences, what the patient needs at that time. Now the final part. This patient has had the surgery. He's had the amputation. Due to circulatory compromise and tissue damage, foot was removed just before. Excuse me. What are critical questions now? We have the same patient, but a different experience, different needs. Some of the needs are the same, but there are some that are different. What are they? What do we need to focus on now? What is the priority? Post-procedure, what are the safety concerns? Have they changed? If so, what are the interventions? Have they changed as well? What new pain concerns are there? Does the patient have any pain at this point? If so, what techniques can be used? What are the major concerns for this patient at this point in care? What is the anticipatory intervention? I do want you to think about one here, and I've given you the reference in the back of the PowerPoint, and it is about game and therapy play related to pain. And I will discuss phantom pain, and I will give you that. I want you to consider phantom pain and how you could intervene. But I do want you to consider play, therapy, and why one might be better than the other. Why would play a potential video game AR virtual reality workflow for this patient. I want you to consider that and think about this status, this lifestyle, and see why it might be beneficial, or why you feel it may not be. Does the patient have any, there again, new pain concerns? I gave you one, and that was fantastic. What are the major concerns for this patient at this point in care? What anticipatory intervention can be started? Make sure you discuss the conversions related to support in the hospital and that at home. Safety is the most important. What are the patient's resources and what changes they need to recover? While he requires continued emotional support, he requires continued emotional support and discharge. After we've gone through the stages, just in primary diagnosis, of course, we know pressure ulcer right here. What do you think? Nurse and treatment. You remember you were using it, giving the link to that. Pick up other treatment diagnoses for the nurse. Alteration in tissue integrity. Vital signs of pertinent lab findings. Again, here is vitals. I mentioned it. It has a temp of 102.1. What might that signify? Considers the capillary refill that the left and right are not equal. He does have an elevated white count. Fasting blood glucoses have ranged 350 to 500, and that was prior to admission and since he's arrived. And the last week or so, he's been stayed high. Even with his medication, what might be the cause of this antibiotic pathophysiology? A1C, it is presently 13. I want you to find out what the number is and tell me why or if this impacts his healing post-pregnant status. I'll give you the chart on your learning competencies and outcomes. Want you in your groups, you'll have this handout to really look at these and consider these when you're having your dialogue. This is just a little help for you as you work through case scenario. And also, here's another tool that's available for you. You can either look at it in the PowerPoint or print it out. Distinguishing between inadequate arterial supply and inadequate venous supply. And then looking at our patient and discussing his status, which one it is, and would it matter which one it is on his treatment. And debriefing. I want you to ensure completion of the NUR600. The link is under resources. You'll go in and go to the module to be complete. Also seek out alternative resources. Have all critical content and activities been addressed on the form that is in the listing of printed out. Any new concerns, provide time for decompression as needed. The resources are listed here. And I want you to access those. Make sure you go into NANDA and look at the care plans that are available. And then go to the NDNQI modules and make sure that you go through those. Okay. And that is pretty much your work for your presentation. You've got everything from the National Pressure Ulcer Advisory Panel, revised pressure ulcer staging form, and if you work for each, you'll be able to complete the. As you work through your PowerPoints, I want to make sure you utilize your PowerPoints, but I also want you to do a little home project. I want you to go through each section with your group. You look at the background, the family history, the medical history, the vital signs, the medical diagnoses, and each stage of what happens next and the critical thinking. And go through those processes and answer those questions and use your chart. Use your chart that was in slide 21. And make sure you go over and make sure you touch on each of your learning outcomes and critical behaviors. You can also utilize the distinguishing between inadequate arterial versus inadequate venous blood flow. Also, I want you to partner up with one of your teammates and assess their fetal pulses. And you can actually do everyone in your group and make note of the hair, make note of capillary refill, make note of the texture, the temperature of their skin, and compare their extremities. See if there's any differences. The slide that has, slide 12 that has the cubits on it, that's wonderful, but the most you'll be doing is with the NDNQI website. You'll log in and create a membership and complete the NDNQI modules. These are very rich. They're scenario-based pressure ulcer education. The last thing I need you to do, you won't be able to do it today. This is an assignment to go home and do. What I want you to do is go home, void empty your bladder, get yourself comfortable, have a little snack, turn your phone off. If you want to put the TV on or if you have any favorite music, do that. And then I want you to get in the most comfortable spot. Make sure you put yourself in the best spot for you, position for you. And I want you to sit there or lay there, whatever the position is, for no less than 15 minutes. If you can do longer, do longer. 15 minutes is the goal. If you can do longer, I want you to record the time. Just continue to do it. Don't get the time when you can't take it anymore, then stop. But I don't want you to scratch your nose. I don't want you to do anything. If the phone rings, let it ring. If you have to, let everybody that knows it's important that you're doing a quick assignment and you won't be able to call them, but you will call them when you finish. Once you finish, I just want you to write a quick little synopsis or an evaluation of the experience. How you felt, what position you were in, what started to bother you, was there anything that happened, but you can't go to sleep. So often we as nurses and nursing students, when we find a moment, we want to rest. But for this, I need you to stay awake so you'll be in tune to what your body is doing. And once you begin to move, note how you feel. And think about that patient who most policies and procedures say we only have to turn every 2 hours. So I want you to think about that. And they usually don't put themselves in the position they want. We put them in what we think is ideal. And I want each of you, when you make note, put the position that you put yourself in. And you'll see the variety of positions they like to be, and people like to be in. So just because it works for us, it may not be ideal for someone else. We don't know their history. Maybe they had a back injury where they can't lay flat or they can't lay in a position they like to. Maybe they have a sore on their side. Maybe for whatever reason, they don't like to lay the way we do. So often we put patients in the positions we like to be in. But I want you to do that for yourself and note how you feel afterwards. And we'll have dialogue on that as well. So that's a little project for you tonight to get some experience on what our patients experience. And remember, our patient is already compromised. That's why he's here, because he's had a decubitus, and that has occurred, and he has decreased blood flow. He's diabetic. I don't want to get into too many details, but I'll answer all your questions for your modules and your assignments. But I want you to think about all of those things and make note of it and consider it, because there again, our patient is already compromised. So we have to be mindful about his positioning. Thinking about bony prominences, I want you to note We always think about elbows and heels. I want you to think about those others, depending on how you lay. So each person, however you lay, look, make note of what the bone prominence is, where the most pressure is over bones. And if each person does it, when we talk about their different positioning, we'll talk about those pressure points. And we'll note also the size of the person can play a role. And see if you intervened for your own behalf when you positioned yourself. You thought about that. So that is your assignment, and that is your experience project or assignment for this portion of the class. If you have any questions, don't hesitate. And also, think about the incongruences of what the patient thought was going to happen and what will happen or what does happen to our patient. And think about the emotional impact, the social, psychosocial impact. And make note of that and what interventions we might have to put into place. And is there a difference between how males respond and women? Are there any experiences in his past that might help him cope or fix it where he put him in a situation where he can't cope? So think about all those things, because that's who we work with. Our patients have different experiences and respond differently. And we have to understand the emotionality that comes with diagnosis and treatment. But if you have any questions, let me know. But we will break up in groups. We'll break up in groups of about 5, so you can act out each role and have the experience of interacting in those various roles and with people, acting out in what they would respond in a normal situation. If you have any questions, let me know. Thank you and enjoy the process.